Welcome to MI Radio's Myanmar Today. I'm Melody, and here are today's reports. Anti-COVID-19 measures conducted in Thingangyun Township. Marble carving workshops amid COVID-19. Demand for pesticides for communicable diseases increased rapidly amidst COVID-19. Restaurant owners to offer takeaway service abiding by guidelines. Before we get to the reports, let's take a look at the featured local news for today. Commander-in-Chief of Defense Services Senior General Min Aung held a meeting with representatives of the National Democratic Alliance Army MILA at the Golden Triangle Meeting Hall of Triangle Region Command on Monday. At the meeting, Senior General Min Aung presented surgical masks, sets of PPE, N95 masks, face shields, examination gloves, bottles of hand gels, bottles of hand sanitizers, foodstuffs, food items produced from Thermidor factories, and medicines and medical items for the surgical unit of the MILA Hospital. These were received by U So Lin and members of the delegation. The senior general also held separate meetings with departmental officials, members of the Thermidor and the Myanmar Police Force, members of local people's militia unit, and town elders at the meeting halls of Triangle Region Command and the Central East Command. At the meetings, the senior general gave cash awards to the members of security forces who effectively participated in narcotic drugs suppression activities and medical supplies for combating COVID-19 in the respective townships. Senior General Min Aung also presented cash awards to members of the Myanmar Police Force who successfully participated in seizing narcotic drugs. Tak Province in Thailand provided relief aid to the quarantine centers in Gyen State, and a donation ceremony was held at the No. 2 Thai-Myanmar Friendship Bridge in Myawaddy, Gyen State on Tuesday through online. At the event, Ambassador of Thailand to Myanmar, Mrs. Supatra Srimatri-Pitcock, said the donation aimed for providing necessary assistance in COVID-19 prevention and treatment centers in Gyen State as part of cooperation of the Thai government with Mae Khao region. She also expressed thanks for cooperation in allowing to pass through Thai-Myanmar Friendship Bridge 2 in Myawaddy, and more tradings will be implemented between the two districts that are the strategic points for trading of the two countries. The Gyen State Minister for Electricity and Industry, U So Lin, also spoke word of thanks for the donation. According to Myawaddy District Administrator, the provisions will be sent to the quarantine centers in Gyen State. The Ministry of Planning, Finance and Industry will continue its relaxation on financial issues, relaxation of taxes, and financial support until the end of December 2020 to boost morale of the general public amidst COVID-19 crisis. The ministry announced on Monday in accordance with a decision of the coordination meeting of the National Level Central Committee on Prevention, Control, and Treatment of Coronavirus Disease 2019 held on the 26th of August. And I believe it's time now for our first report. In wards of Thingangyun Township, the anti-COVID-19 measures were conducted to record the profile of the residents. The measures include temperature measuring, tracing the travel history, and contact with the positive patients. It is to help in contact tracing in order to curb the spread of the virus.
Yangon is suffering more from the COVID-19 infection, which has resurged by the midst of August. With the rising number of positive patients across the country, Yangon becomes the region with the most infected patients. Being populated, it is challenging to perform contact tracing and curb the spread of the virus within the region. So the authorities concerned started to carry out anti-COVID-19 measures in townships of Yangon starting from 8th of September. On the first day, a testing plan started conducting in Thingangyun Township, one of the hardest hit townships in Yangon. Uangchai Township Administrator, Thingangyun Township General Administration Office, said.
Thingangyun Township is the most hit township by COVID-19 in Yangon. We are performing the processes of measuring body temperature, contact tracing to all the people who are residing in 10 wards where positive patients were found by using 10 special buses which are provided by the Ministry of Health and Sports. We will perform testing and measuring in line with health procedures in the whole township in the next days, in cooperation with the Ministry of Health and Sports. This is our duty to perform all these tests because we can examine the silent carriers and the hidden positive patients so that we can perform the prevention against the virus spread in time. We follow social distancing rules by keeping the car 6 feet apart each other, and the administrator from respective wards help us work easier according to social distancing. And we are also informing the people by using hand speakers regarding the health testing plans. We have managed to perform all the tests systematically, one after another, to avoid the crowded situations as much as we can.
Thingangyun Township is currently under a stay-at-home plan, and other restrictions are also released, including the restaurants to provide only takeaway service. The health testing program is aimed to help in contact tracing and to find the silent carriers or hidden contact persons. The ward administrators cooperate together for the smoother processes, including managing crowd gathering. Wu Aomo is the ward administrator of Ngamoye Ward from Thingangyun Township, and he said,
Yangon Region Health Department is to conduct health condition checks in our township. We announced everyone in our township to come and check their health. So we have to tell all the families to be able to arrive in time. We have to copy all the documents of the families, and we have to distribute all the forms which are needed for today to the families. 10 wards of Thingangyun Township are included in this health checking program. The tests will be run from 9 a.m. to the evening. This is the effective program, but we have to notice not together one coming for testing. We urge all the people from our township to participate in this test.
This move is to record the profile of the residents, and the residents are also willing to cooperate in the program. Ko Yen Minai, a resident from Ngamoye Ward from Thingangyun Township, said,
In a specifically designed bus, they checked our temperature with the infrared camera, and they asked if we have any travel history within 14 days and any contact with the COVID-19 positive patients. We are very glad what MOHS is doing for us because people, including me, are frightened by the COVID-19 infection. I always wanted to test my health because we can't know if we were infected. I want to make sure that I'm clear from the infection.
During the earlier outbreak of COVID-19 in Myanmar, in May, the anti-COVID-19 measures like this were also carried out in the specific townships. The Ministry of Health and Sports is accelerating the contact tracing in order to find the infected patients in the earlier stage.
That's the report on anti-COVID-19 measures conducted in Thingangyun Township. Carving workshops in Myanmar began thriving in the early 1990s, and their production rate has increased due to the use of advanced electrical tools. Since then, the number of workshops grew very rapidly. There are many marble carving workshops near Mahamuni Pagoda in Mandalay. In the pandemic, stone carving businesses, which is depending on the orders from rural areas, is also stagnation and facing the difficulties.
Many villages around central Myanmar, especially in the northern part of Mandalay region, are surrounded by a mountain range with a large quantity of marble. An abundant amount of marble Zijin is considered a treasure as a natural resource for Myanmar people. Carving workshops in Myanmar began thriving in the early 1990s, and their production rate has increased due to the use of advanced electric tools. Since then, the number of workshops grew very rapidly. There are many marble carving workshops near Mahamuni Pagoda in Mandalay. In the pandemic, stone carving businesses, which are depending on the orders from rural areas, is also stagnation and facing the difficulties. Ko Min, the owner of Utomye Dokhinchola Religious Material Shop, said.
During this COVID-19 period, there are restrictions to travel to rural areas. Mostly, the donation and religious occasions are usually celebrated in rural area in this season. There are only few orders from these rural areas, and so the sales are obviously going down. It can be said that over 18% of the sales are decreasing in this stone sculpture market. The purchasing in the market is not stable till now. So, we have suspended sand workers from duty. We are still opening and accepting sand orders from customers. If we need the workforce for orders, we call the workers for stone carving on a daily basis. Apart from them, all full-time workers in our shop have to be suspended from working.
Most of the craftsmen earn a living from making and carving statues, mostly religious items. But now the occasions and traveling are restricted to prevent the spread of infection, directly affecting the living of the stone craftsmen. Ko Swanai U, craftsman from stone carving workshop, said.
Of course, the pandemic affects us a lot economically. We usually earn around 20,000 kyats to 30,000 kyats. Since the beginning of COVID-19 crisis in April, we have been suspended from work. We rely on daily work for some orders. The living is also hard for us. We received the financial assistance from government, but it lasted just temporarily. We started the work again from last month. There is no regular work or orders. All the workers work one day and then they have to take a break for one day. This is the way that we are working currently. Now, our daily income is around 10,000 kyats.
The raw marbles in the city are used to be transported from Zijin village, but after the better transportation system, the marble market in Mandalay city is suffering the loss because the retailers and exporters went down directly to the Zijin village, but not to the workshops in the city. Manthiri Tue is producer from Thiri Yadana Marble Workshop from Zijin village. She shared about the marble carving business at present.
The workflow in our villages is still unstable. Despite the global pandemic, we work and receive the orders normally amid the earlier period and resurgence period. The orders are a bit delayed in transportation, but most of the processes are well. In the past, we had problems for the high cost of transportation, but now the transportation is really much better, so the traders purchase directly to our village.
There are more than 100 workshops in Zijin village, and most of which export Buddha statues mainly to China and Thailand.
That's the report on marble carving workshops amid COVID-19. Even before the outbreak of COVID-19 started in Myanmar, disinfections were carried out in houses, hospitals, clinics, offices, religious structures, schools, and markets as part of precautionary measures against the COVID-19. Following the outbreak of the COVID-19, the preventive measures such as disinfection were performed in all parts. At the same time, the raw materials for undertaking disinfection have seen a shortage as the demand has reached a record high. Min Tun and So Min Ang reports.
The Ministry of Health and Sports announced on 23rd March that the first novel coronavirus called the global pandemic of COVID-19 was found in Myanmar. Even before the outbreak of COVID-19, disinfections were carried out in houses, hospitals, clinics, offices, religious structures, schools, and markets as part of precautionary measures against the COVID-19. Following the outbreak of the COVID-19, the preventive measures such as disinfection were performed in all parts. At the same time, the raw materials for undertaking disinfection have seen a shortage as the demand has reached a record high. Uwana, owner of the Kabaja Chemical Liquid Shop, said.
At the beginning days of COVID-19, we were running out of the products to sell, so we had to buy the necessary products from the other people, and we had to pay the price as they said. For the time being, the prices are stable at the normal price. The customers buy the hand sanitizers rather than the pesticides. We have imported products in India and China are exporting the products to us. That's why the prices are going back to the normal. Now the products are imported only from the containers. I think the chemical products are operating in normal, and also the factories are going like normal.
Mild antiseptic liquids such as ethanol, hydrogen peroxide, and sodium hypochlorite are used in the preventive measures against the coronavirus. At present, the raw materials in use of antiseptic have seen enough amounts in the market, and their prices are not hiking as well. Tontong Ang, Deputy Officer of Thingangyun Township Red Cross Society, said.
We have conducted spraying pesticides in the wards since the virus began. We disinfected once in 2 days. We also carried out disinfection in the crowded markets. All of these procedures have been done by the cooperation with the Red Cross teams, volunteers, administrators of the wards, and auxiliary firefighters. Since the resurgence of the pandemic has come and we are spreading awareness to the people residing in the crowded places like markets and bus stops, awareness includes wearing masks and washing hands. Now we are planning to perform the task of spraying pesticides in collaboration with the administrators of the wards. Mainly, we will spray the pesticides to the door in the apartment, the stairs of the condominiums, and the drain cover.
Utanaiu, Region Lhotor representative from Thingangyun Township Constituency 1, said.
In the meantime, we are on a campaign to donate face masks for the public. If the regional government instructs for the quarantine center, we will donate sanitizers to the centers and the hospitals. We already sent the sanitizers to the centers, but now we will donate the area in urgent need by connecting with the donors. We will be disinfecting mostly in the crowded areas and the markets.
Mao He, administrator from number 4 ward of Thingangyun Township, said.
Our next project is to donate the face masks to the public and to sanitize the areas. We donated about 5,000 boxes of face masks. We now continue to donate 1,000 boxes and hand gels. To spray the sanitizer for the whole ward, we are now collaborating with the Red Cross Society and the local residents. Previously, we arranged the places to wash hands to the ones who live in these streets and give face masks and hand gels to them. We spray the whole wards at the time like now we are doing. In the present, the conditions are worrying and we are now carrying out the preventive measures as much as we can.
For the time being, the resurgence of the COVID-19 has come back and the reported cases are on the increase. Disinfection has been rare in the wards and the townships, and like in the past, much work for disinfection has not been seen. But the people have become well aware of wearing masks and washing hands.
That's the report on demand for pesticides for communicable diseases increased rapidly amidst COVID-19. In Yangon region, the biggest population in Myanmar, where COVID-19 disease spread rapidly. Therefore, the Ministry of Health and Sports announced stay-at-home programs in some townships starting on the 1st of September. The government also gave guidance to serve takeaway service at restaurants, tea shops, and food stores started from Tuesday to prevent crowded cases and to effectively control of COVID-19 pandemic in Yangon. Hae Min Let, Now Lee, and Yan Nai reports.
The government is taking action against the resurgence of COVID-19 pandemic effectively. Some restrictions are being implemented again, including stay-at-home program and some other measures throughout the country. In Yangon region, the biggest population in Myanmar, where the COVID-19 disease spread rapidly. Therefore, the Ministry of Health and Sports announced stay-at-home program in some townships on 1st September. The government also gave guidance to serve takeaway service at restaurants, tea shops, and food stores started from 8 September with a view to prevent crowded cases and to effectively control of COVID-19 pandemic in Yangon region. Most of the restaurants mentioned to follow the directives while serving takeaway service because they are more willing to accept this system continuously better than to close the shops. Ukukujo, owner of Chaudada restaurant, said,
We are encountering the problems. There are no customers in our shop because we have been instructed to serve takeaway service only. For the customers who are working in offices, buying with bag food is convenient. But for other customers, they have to buy food through takeaway service and have to eat in parks or other places which are suitable to eat. We don't sell to the customers for eating in the shop because we have been instructed by the government. But we are glad to get a chance to sell only takeaway. We are ready to follow the rules imposed by the government. We had been totally shut down in the first wave of pandemic, and we reopened our shop in the same time with offices. But this time we thanks to the government for considering for us. I think our government is trying to help me by letting us to sell takeaway system.
Right now, at Thingangyun Township in Yangon region, where most of the COVID-19 positive cases occur, some restaurants and shops already closed and some are still opening only to serve with takeaway system. Normally, we have around 700,000 kyats income per day. However, to sell in takeaway system, we got nearly 300,000 kyats income per day, spoke by Dotri Kind, restaurant owner.
We have been instructed to sell the foods only with takeaway system, and fortunately there was a positive patient found in our ward, so I have no idea what will happen next. If the authorities instructed us to close our restaurant, we have no choice except closing our restaurant. We had taught our workers to wear gloves and face masks when serving the foods with takeaway system. We had sprayed the menu with disinfectant. We are selling in that way.
For the restriction of the serving system at restaurants and shops, local basic workers can face difficulties for their meals due to preventive measures of COVID-19 spread. Min Sotong, customer at Thingangyun Township, said,
We have some difficulties with takeaway system. We are basic workers and we have to eat at food shops. The vendors also have difficulties. However, the takeaway system is also fine because it is a rule formed by the government. So, we have to follow it. It is important. As the president and the state councillor restricted the rules to protect the infections, we must follow these rules.
The government announced the orders to serve takeaway system will encounter some difficulties of most of the owners, although they are able to follow and implement this order due to safety measures for the people.
The purpose of the government was good. This is for the good of whole country, so we do not have to say much. As the virus is raging, we will have to follow the restrictions. We have a lot of difficulties to change back takeaway system once the sales are on the way back to normal.
အခုကရောင်းကောင်းမယ်တော့မရှိဘူးဗျာနောက်တစ်ခေါက်ဒီကိုပြန်ဖြစ်တဲ့အခါကျတော့ကျွန်တော်မှအခက်အခဲတွေအများကြီး
That's the report on restaurant owners to offer takeaway service abiding by guidelines. Now we move on to international news. Late-stage studies of a COVID-19 vaccine candidate developed by Oxford University and a UK-based company are on temporary hold after a patient suffered a suspected serious side effect. In a statement issued on Tuesday evening, AstraZeneca, the company said its, quote, standard review process triggered a pause to vaccination to allow review of safety data. End quote. The drug maker didn't reveal any information about the possible side effect, expect to call it, quote, a potentially unexplained illness, end quote. The health news site Stat first reported the pause in testing, saying the possible side effect occurred in the UK. An AstraZeneca spokesperson confirmed the pause in vaccinations covers studies in the United States and other countries. Temporary holds of large medical studies aren't unusual, and investigating any serious or unexpected reaction is a mandatory part of safety testing. AstraZeneca pointed out that it's possible the problem could be a coincidence. Illnesses of all sorts could arise in studies of thousands of people. Irish Foreign Minister Simon Coveney said on Tuesday, European Union negotiators will not do anything to appease the British government in the wake of its gravely concerning threat to break international law. The British government's Northern Ireland Minister Brendan Lewis earlier said Britain could break international law, but only in a quote-to-quote limited way, after reports it may undercut its withdrawal agreement divorce treaty signed with the EU in January. Coveney, a key figure in Brexit talks over the past 2 years, told the Irish Parliament, quote, there will be no appeasing of this approach and there will be no condoning of a strategy that proposes to breach international law to undermine an agreement, end quote. Any departure from the terms of the withdrawal agreement could, quote, seriously erode and damage political trust, end quote, in Brexit talks, and in keeping the peace in Northern Ireland. Coveney added, however, that Ireland and the EU will continue to take a calm and measured approach to the Brexit talks. Social gatherings of more than 6 people will be banned from September 14th and fined if they fail to comply, with some exemptions amid concern at rising infection rates, particularly among young people. The number of cases in Britain has begun to rise sharply again in recent days. Although testing is more widespread and the number of people in hospital is well below the peak of the outbreak, ministers fear it is beginning to slip out of control. The government currently says people must not socialize outside in a group of more than 6 people from different households. But the law actually puts that limit at 30 in private spaces. From Monday, this will be reduced to 6, except for large families, weddings, funerals, organized team sports, workplaces, and educational settings. That's all with the news and reports on Myanmar Today. Hope everyone is staying safe.